Welcome to the Public Healthpreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm your host, Quisha Umemba, a registered nurse, public health practitioner, nonprofit founder, authoress, and entrepreneur on a mission to ignite conversations that matter. I've dedicated my career to the pursuit of health equity and to transforming the lives of individuals and communities. And now my passion project is empowering public health professionals to become public health entrepreneurs. My journey is a testament to the potential of this field, and my goal is to ignite that potential within you. Here's what you can expect. In this podcast, we will dive deep into the world of, well, you guessed it, public health and entrepreneurship. Whether you're a seasoned entrepreneur looking to expand your impact, or you're new to the field of public health and consider yourself to be a public health enthusiast, this podcast is your go-to resource for valuable insights and actionable advice, helping you to challenge the status quo and break free from convention to become an unconventional agent of change, creating meaningful and sustainable impact for those you serve. Let's get into today's episode. I thought before we got too far into this podcast, you allow me the opportunity to introduce myself. And there's so many facets of who I am and what I bring to the table. I'm sure like many multi-passionate, overachieving, multi-dimensional public health entrepreneurs and consultants. But I'd like to call this episode today, Quisha the Nurse, Quisha the Public Health Practitioner, and Quisha the Public Health Entrepreneur. Because I want you to really get a feel for who I am and some of my experiences before you really get into listening to what I'm going to be sharing with you over the next few weeks to months and subsequent seasons of the Public Healthpreneur Podcast. So if you'll allow me to take a minute, I'd like to introduce myself to some of you and reintroduce myself to others and share a bit more about who I am and what I'm all about. So I, if you did not know, am a registered nurse. I am a nurse at my core. I write about it in my book. Nursing for me was more than just a job, more than a career, more than a profession. It really was my calling. And I've always wanted to work in a helping profession. I can remember growing up being just passionate about helping others and making a positive impact in my community. And even before I knew the term community health worker, I was a community health worker. Always, worked community events or health fairs at the church, or just even helping my family and my grandmother take care of people in the community was something that was always just near and dear to my heart. I started out, I would say, in this journey as a candy striper at our local hospital when I was 16 years old. And that's really where I got my love for medicine. I love all things blood, guts, and gore. And I was really into all of the forensic shows, CSI and the other shows that came on in the late 90s. And I thought about becoming a medical examiner, had my heart set on going to medical school and becoming an MD, as many of us in public health. And then life happened. I married at 18. I had my oldest son at 19 and decided, you know what, medical school is off the table. I'm going to start with my medical assisting certification. So I did a 10-month medical assisting certification, really liked it. Actually, I loved it. And I ended up graduating as valedictorian of that program. And it was the general instruction of one of my instructors who at the time told me on the day of graduation, like, Quisha, you can't stop here. Like, you would be the perfect nurse. You've got to continue pursuing your education. And so I did. So I enrolled in the local community college and I got all of my nursing prereqs. And that took about 18 months. And then I fast-tracked an ADN, associate's degree of nursing. I fast-tracked ADN degree in about 18 months as well and became a registered nurse. And over time, I would eventually get more certificates. I went on to get my bachelor's in nursing. I've worked in so many different areas. I started out in surgical ICU because that's where I thought all real nurses went, to either emergency department or ICU. I did that for a year and realized that I hated it before I transitioned to a long-term care ward and eventually landed in the diabetes and endocrinology clinic, where I fell in love with diabetes and diabetes self-management education. So without giving too much of that and just really kind of stay at the high level, um, some things that I think really have stood with me throughout my career has been rooted in me or embedded in me since I was a nurse. And so as a nurse, there's so many technical skills that you learn, but it's just you're up against the ropes a lot. And I can remember just loving the challenges that came every day with being a nurse and having to stretch myself and develop personally and professionally, and having to come up with a bandage on the fly, or not having the right equipment that you need, and having to be innovative and creating something to make your patient comfortable, or to get them, patch them up until they got to surgery. And the surgery, the OR was full, and maybe there was an hour or two before you could even get them in there, and you're pumping blood in to try to keep them alive. It was crazy. And every day was different. And I absolutely loved it until it didn't love me back. And I'll be honest, I felt like I was taking care of patients, seeing the same people come in and out, come in worse than they were when they went out the previous time. And I started feeling hopeless, started feeling like this is not what God called me to do. I'm not making an impact. I took things really personal, really, really personal, as a testament to the type of care that I was providing. And really started seeing myself kind of go into a funk, a depression of sorts. And then I went to get my BSN, and a windshield assessment assignment that we did in a community nursing class is really what motivated me, kind of the first thing that motivated me to pursue my master's degree in public health. And if you don't know what that is, it's basically you drive around, or you walk around, preferably drive, in like a 2-mile or 5-mile radius in your particular neighborhood or in a particular community. And you make note of everything that really is a public health issue. And that was the first time I really looked at everything in my environment and realized that everything has to do or impacts how we live, work, play, pray, age, and so on. And so that was the first time I was introduced to the social determinants of health. Really didn't have the language for it at that time, but knew that there was something that was keeping my patients sick, and a reason why they weren't as supported to be healthy or to live in healthy conditions when they were outside of the hospital walls. And so after I got my BSN, I talked to one of my physicians and I said, "What is this MPH that's behind all of the doctors? All I see is MD, MPH, MD, MPH." She said, "Quisha, you would love a master's in public health." And so I did a little research and decided that's what I would do next. And so I did. So now let me tell you a little bit about Quisha, the public health practitioner. So I consider myself lucky. When I landed my first role in public health, I actually started applying for positions about 8 months shy of graduating. And I literally prayed and said, "God, I need a job that combines nursing and diabetes and public health." That was very specific. I want a job that combines nursing, diabetes, and public health. And the first job that I applied for was chief nurse at the Houston Health Department in the Office of Chronic Disease Prevention and Management, and overseeing 2 programs. One was the colorectal cancer program, and one was the diabetes program. As a matter of fact, the Dawn Center, Diabetes Awareness and Wellness Network. And I absolutely loved that job, again, until it no longer loved me. I got bitten by the public health bug in this position. And I did not think I would love middle management, because middle management is kind of tough. And a lot of people like either to be in management or out of it, and certainly not in between senior leadership and the boots on the ground. And I loved it. I love leading. Matter of fact, I love leadership so much, I've completed 1 year of a doctoral program in leadership. but it was excellent. And it's when I got my first experience with program management and implementation and evaluation and grant writing and, writing annual reports or reviews for employees and hiring and firing. And oh my God, the list goes on, developing, web programs or, spearheading those efforts and partnership development, strategic planning. I mean, so many skills. I always say that public health is one of those degrees that if you go and work in public health, chances are you'll utilize every single skill set that you learned when you were in school. And I got to do that in that first position. I absolutely loved it. Um, I was able to also be very plugged into the community, which I loved. I did a lot of community events, health fairs. We had a mobile unit. I went out in the community. Of course, I did speaking engagements, but I did trainings and workshops, training my staff, going to watch them do trainings. I mean, it was a great time. And it was also a time when I witnessed firsthand how the social determinants of health, like poverty and education and access to healthcare, can really significantly impact not only an individual, but an entire community. And I also witnessed how communities in the same communities rather, can be empowered and uplifted if they're given the right assistance and the right support with the tools to help foster self-efficacy. And I never felt closer to the community than I did in my role as chief nurse at HHD. I will always say it's probably one of my favorite jobs. I'm grateful for the experiences and lessons learned there. Some of my staff that I supervise are now my very, very best friends. I mean, it was really a family environment. And looking back on it, I actually didn't realize this until after I left, and I was there for 4 years. Looking back on it, I did not have one single person turnover that was under my leadership, which is almost unheard of when you're talking about health departments, because we know how turnover is in health departments and in healthcare in general. So after leaving HHD, and I'm not even going to get into how I left, why I left, and all of those things. If you have not picked up my book and you're interested in knowing more about that, then I recommend you just get my book and you read it. But after I left, I went on to work for the Texas Department of State Health Services as a diabetes nurse consultant. And that was a cool role too. It was slow. I don't know if depending on what role you work in the state, it certainly was not my pace. Quite frankly, I was bored out of my mind, literally. And I thought I'm not going to say it was easy. I'm not going to say that. It's just that it was the first time I really understood what a consultant is and does. And as a consultant, I was responsible for providing my clinical expertise, advising organizations throughout the state on their programs. So diabetes prevention programs or diabetes management programs. Some would have related chronic disease programs, so hypertension, stroke, a lot of multidisciplinary, multi-sectoral partnerships. Of course, we had grantees because the state had some grant funding. And so oversight of those organizations that were grantees. And it was a very enlightening, eye-opening position for me, because one of the reasons that I went there, outside of the bad experiences that caused me to leave HHD in the first place, but one of the reasons I went there is because I wanted that title, diabetes nurse consultant. Not necessarily diabetes nurse, but I wanted the title of consultant because at this time, I'd already kind of been thinking I could probably do this for myself. Manage all of these programs and manage the people and the initiatives and, the back of the house and write the grants and respond to RFPs. I think I could probably do this for myself, but what exactly does a consultant do? And when I went into this role and realized that most of consulting is providing technical assistance, that technical assistance comes in a variety of different forms. That could be developing a curriculum, putting on a workshop, resource development for a toolkit, whatever that looks like. But once I realized that in itself was consulting, I knew that it was the sky was the limit from there. So in that role for probably about 6 months, I told my husband, I'm bored out of my mind. I got to start another business, because by that time I had attempted business a couple of times and they were just expensive hobbies. They were some big flops. But yeah, that's when I knew I wanted to really go big or go home with this public health entrepreneurship thing. And it didn't end well for me. It did not end well for me once the state caught wind or became aware of my business. And again, another teaser. I'm not going to go into details in this episode on that, but if you have the book, it's in there. If you don't have the book, pick it up. And yeah, it's definitely a lesson that I've learned and one that I share with others as well. Let's just say I was given an ultimatum and I decided to chunk them the deuces and go out on my own. So now let me talk a little bit about Quisha, the public health entrepreneur. So I have to be honest, when I left the state, I didn't immediately go out on my own. I was very intentional about the type of employment that I was looking for after that. And I remember, telling my husband, telling my friends, I'm going to go work for an organization that is not going to feel threatened by me or my growing business, right? I'm very big on speaking things into fruition and into existence. And lo and behold, about 3 months after that, I went and worked for a corporate organization as a clinical programs training specialist. I just like to say corporate trainer because it's a mouthful. And they were not. They were not threatened. As a matter of fact, I think they were more impressed than anything. And I remember each interview, and I did 4 interviews, the question kept coming up: how are you going to manage your business and work for us? How are you going to do this and work for us? And at the time, I had subcontractors, and every time I would get a contract, I would just get another subcontractor that would primarily kind of be like the project manager over that particular project. And I did that for 2.5 years until I could not scale anymore. It just wasn't making sense financially. My CPA was like, "Oh, you're making good money, but you're paying it all out." And it just didn't make the best sense. So what should you know about me as a public health entrepreneur? If you read the book, or if you've read the book, you probably have, could get a sense of the frustration that I have in the limitations of traditional public health program implementation. I am an intrapreneur, and I was an intrapreneur before I was an entrepreneur. And so if you're not familiar with that term, that basically is an employee that functions as an entrepreneur at work, which public health is not ready for. I will say that. But to that comment, I was always thinking outside of the box, constantly innovating and creating. And I call myself the 90-day girl. We're going to do this for 90 days. And after 90 days, if it's not working, we're going to figure out another way to do it so that it runs better. And guess what? If we do this in 90 days and it is working, we're still going to revise it and figure out a way that we can do it better and smarter and quicker and faster. And so I was really nimble and, very quick to change gears really quickly. And when you work in government, when you work in public health, when you work in some agencies, there's so many levels of approval. They're not able to keep up with the speed in which I was used to working. And again, that comes from, working on the floor, working in the ICU, moonlighting in the ER, doing all those things as a nurse where you're moving and shaking and you're just sometimes making it up as you go, right? But that's how I served. And when my community needed something, when my staff needed something, I started asking for forgiveness, not permission, because I wanted to make sure that my people could be served appropriately and in real time. And that bureaucracy, that red tape that you have to go through in government, in public health, really started to get to me, really started to frustrate me. And I wanted to be able to affect change, or create change rather, in a more agile and effective way. And so I started looking and researching, and, I started my business and what's out there, what can I do? What do I love? And initially I wanted to do everything. I'm a nurse. I can do it all. I can save everybody. I can do all the things. And, I just kind of narrowed down each year. Been in business now 4 years, and just get more clarity every 6 months, more clarity. And realize now, workforce development is where I want to be. It allows me to create, it allows me to teach, it allows me to speak, it allows me to, all the things I love to do. I can do that within the confines of workforce development and provide technical assistance in a number of different ways to public health organizations, healthcare systems, nonprofit foundations, what have you. So that's a little bit about me as a nurse, as a public health practitioner, and as an entrepreneur. So what do you need to know now? Right now, you need to know is I'm the CEO of Umemba Health, which is a public health workforce development consulting and training agency where our mission is to transform public health through comprehensive workforce development. We help healthcare systems and public health organizations to educate their workforce, empower their leaders, and expand their community presence. And we do that so that they can elevate the lives of individuals and communities that they serve. And you should also know that I am the public healthpreneur and that I teach helping professionals how to build, launch, and scale profitable public health consulting businesses that make impact and income. I don't care what anybody tells you. You cannot make a difference if you are broke. The more that you earn, the more that you impact. And so I do encourage and I do teach from my mantra of being purpose-driven and profit-focused. Hey, I hope you guys learned a little bit more from me about me today, and I hope it entices you to keep coming back for the next episode. I'm excited about this journey, how it's going to unfold. And just to recap, season 1, we're going to talk a lot about the book. So if you don't have the book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit, go get it. It's on Amazon, Barnes & Noble, all your other major book retailers. And I'm excited to keep this conversation going. Until next time. Thanks for tuning in to the Public Healthpreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm Quisha Umemba, the Public Healthpreneur, and I hope you enjoyed today's episode. For all things public health entrepreneurship, be sure to follow me on social media at Quisha Umemba or The Public Healthpreneur. You're also invited to join the Public Healthpreneurs Facebook group where we continue the conversation after each podcast episode. Need help to start, grow, and scale a profitable public health consulting business? Hire me to be your coach. Want to pick my brain? Buy my book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit, available at all major book retailers and on my website at QuishaUmemba.com. Until next time.